Hey, gang. All right. Well, we are going to do a little review of the heart anatomy from Lab 2. So, just a reminder, remember this lab is probably one of the more shorter labs we did, and that's just because the heart, there's only so much you can really talk about when it comes to the actual anatomy of the heart. But hopefully, with using the sheet models and using the images and using all the actual lab models themselves, you should be able to identify all the structures that we ask of you for this section of anatomy. Okay. As we can see starting off, so compared to last week, we have a significant reduction in the amount of learning objectives we have. Okay, we only have 3 of them. All right. So I think it's pretty straightforward on what we're asking of you. Okay, when it comes to this lab, we only have 3 things that we need you to really get down. Okay. First one being name the membranous sac that surrounds the heart and list the 3 layers of the heart while in the appropriate order. Okay. Identify the indicated structures of the heart on images, heart models, and sheep heart specimens. And then trace the path of blood flow through the heart. Okay. So 3 things, 3 easy things that we can do today, all right, with these videos. And we're going to do that. So only things we're going to need, obviously we did these in class, the heart model and the sheep hearts. We have the sheep heart pictures on our lab manual here, which we'll use to answer this part of the learning objective, part 2, number 2. Okay. But let's start with number 1. All right, just going down here. So just a little review. So the cardiovascular system consists of the heart and the blood vessels, which the blood vessels we'll talk about in a different lab. The heart is a muscular pump that keeps blood flowing through the vessels, and these vessels deliver blood to all the body's organs and then return it back to the heart, which we know about. The heart is located in the thoracic cavity in the mediastinum between the lungs. Roughly weighs around 10 ounces, and it's about the size of one's fist, all right? The size of the heart can also differ. This is just a fun fact, just depending on how active someone is. Okay, so usually a lot of athletes, when they use their muscles in their body and their body demands more blood and more oxygenated blood to be shipped off, the heart can actually grow in size to be a little bit bigger because it needs more blood to be shipped off to those muscles for exercise and various other activities. Okay, so just a little fun fact there. The heart is enclosed in a membranous sac called the pericardium. All right. Remember, that was one of the learning objectives, so I'll give that guy a little star there. Pericardium. And it anchors it to other structures in the thoracic cavity. And it allows it to beat with minimal friction, right? We don't want friction, right? That's why we have a bunch of fluid all over the place. If you remember back from the muscle unit, we had bursa sacs, which are little kind of pillows and sacs of fluid that reduce friction of tendons on bone, okay? The heart wall consists of 3 tissue layers. The endocardium is a thin layer of epithelium and loose connective tissue that lines the inner surface of the heart. The myocardium is a thick layer of cardiac muscle that is the basis of heart function. And the epicardium is continuous with part of the pericardium that encloses the heart. Okay, I'm just going to zoom in here so we can see these guys a little bit better here. So we have the pericardium here. All right, it's kind of this like white looking thickish layer. Okay, remember this is like the sac, all right, the membrane that kind of encompasses the entire heart, helps reduce friction. From deep to superficial, okay, deep to superficial, the endocardium, quite easily, endo, inter, right, endo, within, internal. Endocardium, all right, on the inside of the heart, it lines the entire heart wall. It's kind of this thin, whitish, kind of pink looking layer that I'm using to trace with my little pen here, okay? Lines the inside of the heart. Myocardium is quite easy. It's the larger of them. It's just kind of this big open blob of muscle on the inside. And myo means muscle in Latin, so it's the muscle of the heart layer, myocardium. And of course we have the epicardium, which is the most outer layer, and it's the continuous part of the pericardium that encloses the heart. And it's kind of this purplish looking layer here I'm tracing with my pen here on screen. Okay, so that's it for the layers of the heart. Pretty straightforward, but if we're going to do these, remember, from deep all the way to superficial, meaning we're starting from the most internal part and we're moving our way outwards, so up towards our skin. This is what it'll be. So the deep is going to be the endo. All right. Moving from there, it's the myocardium. And then lastly from here, it is the epicardium. All right, and if you wanted to throw in the pericardium in there as well, you could do that. They would technically be the most superficial since it's more superficial than the epicardium, but cardium here are quotation marks. Okay. All right. So pretty straightforward there. That's the first learning objective down. You just need to know the 3 layers. All right, know the 3 layers of the heart. Know the sac, the membranous sac. All right, that anchors the heart to other structures, and know them from whichever order we ask you. So that could be from superficial to deep or deep to superficial. Just make sure you know the order. Okay. Just with that, let's just cross this guy off really quick. All right. Boom. Got that guy done. All right. Perfect. So let's just end this video here, and then we're going to go back and we'll get all these structures in the next video. I don't want to get too far ahead of myself, but we'll get these structures here in the next video. This will be our second learning objective. We'll go from there.